Oh, should I start over, Mac?
Yeah, start over. Thank you.
Okay, well, welcome again, everybody. We just started the broadcast a couple of minutes late, so welcome back. For those of you who've already been on, but welcome to those that have just joined. We'll start over here. Welcome to the Pikes Peak Small Business Development Center Recovery and Resiliency Series called Understanding the Red Dial. This is in partnership with our partners at El Paso County Public Health. And today's event is strictly educational. So once again, this is a non-political event. What we're talking about is the red dial, understanding the regulations, and how to stay compliant. Our purpose as the SBDC, if you can go to that next slide, Mac, is to help existing and new business grow in the Pikes Peak region. We are a component of El Paso County Public Health. We're first federally funded by the Small Business Administration, have close ties with the Office of Economic Development and International Trade. Again, we are here to educate you as a small business and answer today's mostly a question and answer time for you on what do you have questions on for your small business? How can we make sure that you are staying in compliance and being safe for your customers? The Small Business Development Center offers free consulting for your business for the life of your business. We are not membership based. Please, please, please use us to support your small business to answer any of these questions that you have. PikesPeakSBDC.org is our website. PikesPeakSBDC.org/prepare is our website that has all the latest information on regulations, grant and loan programs to help your business through the pandemic, and so much more. So please take a look at that. I could talk all day, but we have so many amazing guests here with us. I'd like to thank our sponsors, El Paso County Economic Development and Park State Bank and Trust, Lumen Technologies, Tar Springs Utilities, Vector Bank, and the Small Business Administration. You will hear us say that every time because we are able to give you free support for the life of your business because of our partnerships. My name is Ekta Markulier. I'm the Executive Director of the Pikes Peak SBDC. I am now privileged to pass the baton over to my coworker, Mackenzie Tamayo. Mackenzie has been brought on as our COVID-19 program manager, utilizing CARES Act funds that we received from the Small Business Administration strictly to help educate and bring the right content to our small business community. So Mackenzie, thank you so much for organizing all of this and having so many amazing guests today. The screen is now yours.
Awesome. Thanks, Ekta. I so appreciate you introing everybody and myself, and we're so excited to have you be a part of this today. And I'm going to echo what Ekta said in regards to if you have any questions. This is a very question-forward event, and so we're going to go over some of the top questions that we have here that they have kind of put together, that El Paso County Public Health has put together, that I'm going to help kind of monitor in that regard. But there is questions there on your tab on the right-hand side. So please put your questions in there as we go along. We'll be sure to field those. We're going to leave about 20 minutes here in the front end to kind of answer some common questions. I'm going to talk a little bit about our Bundle Up campaign with the SBDC, and then we're going to finish about 20 minutes with any questions that you have along the way. So, but first off, I would really love for everybody to meet who is on the panel today. So panel, if you don't mind just kind of going through kind of top to bottom, just say your name and your title and a little bit about what you do. We won't take too long with this, but just so everybody kind of has an idea of who's on the call, that would be great. Starting with you, Sammy.
Absolutely. Good morning, everybody. My name is Sammy Jo Lawson, and I'm the Retail Food Program Manager for El Paso County Public Health.
Awesome. Marla?
Good morning. My name is Marla Lucky, and I am an Environmental Health Program Manager with El Paso County Public Health. I oversee childcare, body art, several other small programs, air quality, contract management for El Paso County.
Kat?
Good morning, everybody. I am Kat McGarvey. I am the Water Quality Program Manager for El Paso County Public Health, and mainly in the public swimming pool realm and gyms would be my capacity for the dial changes.
Kim?
Good morning, everybody. My name is Kimberly Demers, and I am the Environmental Health Administrative Supervisor.
Natalia?
Good morning. Natalia Gayum, a communicable disease epidemiologist and a COVID-19 outbreak supervisor.
All right, and I don't know that Stephen was able to join. Badi?
Happy Wednesday, everybody. My name is Fadi O'Connor. I'm an epidemiologist. I work in our data and analytics office here at El Paso County Public Health.
Awesome. Lisa?
Good morning. My name is Lisa Powell, and I'm the Emergency Preparedness and Response Program Manager for the Emergency Preparedness Program at El Paso County Public Health.
Janelle? Janelle on? Just or. How about Lori? You might be hopping on here in a little bit. Awesome. Okay, well, we've got a good amount of people here on today that are going to be telling us more, answering some questions. They wanted us to kind of emphasize that there is an awesome website that you can go in for testing information. So these slides will be given to you here at the end. Again, like I said, please put your questions on the side. But all of this information will be given to you, as well as a recording of this, so you have it for future use. But we're going to hop right in with Miss Sammy Jo, as there's probably a lot of questions in regards to what's going on in kind of the retail and food industries and whatnot. So I think the first question is that people are finding is, how do I apply, for extended outdoor seating, and what does that look like? So talk to us a little bit about that.
Absolutely. Thank you, Mackenzie. So we tried to make it as easy as we can to apply. So actually on our website, if you go to elpasocountyhealth.org, you can select the environmental health button, and then in the drop down, retail food. And under that, you're going to see a bunch of different COVID-19 resources, one of which is the application for outdoor dining. So it's a fillable PDF. And that's something you can just answer the questions that we have listed on that PDF, and then go ahead and email it to COVID Business Recovery at elpasoco.com, and then myself and my team will go ahead and review that. So that is the quickest way to fill out that application for us. And one thing to keep in mind is that you also need to be aware that you might need additional sign off from the city for planning purposes and zoning department, as well as the fire department. So I also have a handout that the Colorado Springs Fire Department put together that also lets you know how to get a hold of them for that. So it's really important that if you're putting up, let's say, for example, a tent or some sort of temporary structure that you're going to have a heating element in, we want to make sure it's done safely so that you can coordinate with the fire department. And all of that can be found right there on our website.
Awesome. So can you talk to us a little bit about what's considered an outdoor space?
Absolutely. And I know that's the biggest question right now, because with indoor dining being closed, in order to offer dining, it has to meet the definition of outdoor dining. And the easiest way to describe that is really you're trying to think about the walls, whether it's a structure or a room. And thank you, Mackenzie. This is the document that I also have listed on our website. It's from CDPHE. It goes through and explains, it gives you some examples of what would be considered indoor as well as outdoor. And I know every restaurant is different. I know some existing indoor spaces do have garage doors for walls that can fully open up. And so we definitely want to explore that and see if a full wall is opening, if we could utilize that to meet these definitions of outdoor. The thing to keep in mind, though, is that you'll notice the definitions talk a lot about adjacent versus non-adjacent walls. So the trick is we ideally want to have opposite walls open so that you create that tunnel. So you have open air that's fully flowing through either your establishment that you're trying to create an outdoor space in, or if it's a tent or a temporary structure. And the other question I get a lot on this is about igloos or teepees, things like that. Keep in mind that if you're going to have all the walls down and there's just one door, and if there's any sort of roof, even with a teepee, even though there is an exit there, that's still considered closed and closed walls. So therefore, that's still an indoor space. And not that you can't use it, but you need to realize that you couldn't put more than one party in there at a time. Again, because you're essentially creating air that's going to get trapped in there as an indoor space. So that is another key thing I get a lot of questions on. And this document is a great way to evaluate what you think your structure falls into. But again, please feel free to fill out that application or reach out to myself or my team directly, because we know all your situations are different. And that is really what my team is focusing our energy on right now, is helping you navigate those definitions.
Awesome. And so in regards to if people want like additional information, you said to reach out to your team, how do they do that? What's the best way to do that?
Absolutely. So we do have a COVID-19 call line set up within environmental health, and that phone number is 719-578-3167. And we do have that phone line staffed throughout the day. And on the weekends, we do have somebody checking those voicemails. We rotate through that. So please know that if you call that line or if you leave a voicemail, we are absolutely getting back to that. Or you can straight email your questions to the COVID Business Recovery at elpasoco.com. Either way, we can absolutely help with those questions.
That's awesome. Can you talk to us a little bit about financial support for outdoor dining and what that looks like?
Yes, absolutely. So I know there's a lot of great resources that the small business groups here locally that you're hearing from today offer. Another big piece for you to know is that the Colorado Restaurant Association has dropped their fees as far as what is available as a non-member. So I did speak to Molly Steinman, who is with the Colorado Restaurant Association at the state level, and I encourage every single one of you to visit their website, because they actually have free legal advice for restaurants right now. And again, you do not have to be a CRA member in order to access this. It also has a work group that we put on as a state. So this work group was organized by the Colorado Restaurant Association, and then they invited architects, various public health officials, retail food program managers such as myself, as well as the fire department, and actually put together some designs. Mackenzie, if you wouldn't mind pulling up that link for the CRA, it'll show, it actually gives all of the different designs that we came up with. And so there's some that are geared more towards sidewalks, some that are geared towards outdoor structures and parking lots. Also, some of our more remote counties and up in the mountains, and those that deal with more snow. So please know that their website is a wealth of knowledge for that piece. And we'll make sure that you get that link as well. So again, it's the Colorado Restaurant Association's website, and that's where you can obtain all of that information. And that way, we already have designs that we figured out and defined as indoor, outdoor, so you don't have to think about it. So if you've already thought about, hey, could I use a greenhouse? Could I use an igloo? Could I use, a shipping container? A lot of those things are already designed, and they have all the pieces. So you can either buy it as a group, or it lets you know how you could obtain each of those individual items to create those seating areas.
Awesome. Could you talk to us a little bit about this site too as well?
Yes. Yeah, and I'm sorry, Mackenzie, the site that I'm speaking about isn't on our website, it's a different one, but since we have this up, if you scroll down from retail food establishments, you'll see right there COVID-19 resources, and this is where I'm talking. So that very top one is the information from our partners. So that's where you can figure out from the city as well as the fire department how to get a hold of them and what their needs are. So this is going to help walk you through a lot of that. It again explains the fire safety considerations, and at the very bottom, how to get a hold of them. And this is something that we put together. You'll see all the agencies at the bottom that work together to create that. Another document on our website is, again, the CDPHE part that we went over that gives the definitions indoor versus outdoor. We also have on there a quick reference guide. So that fourth one, yep, that is something that my team put together, so that we tried to just put, I know there's a lot of links out there, but this is just kind of a quick tool that if you have a question, this will take you straight to the link that you need to know. So it talks through outbreak guidance, where to find that on our website, just because I know websites can get frustrating to try and sift through sometimes. So I tried to break this down and make it a helpful, quick tool for you to use. Lots of great resources.
And the SBDC also has free legal help with our partnership with OEdit. So you want to contact the SBDC if you have any questions in that regard. Anything else on this site, Sammy Jo, that you think would be pertinent and helpful?
Just letting you know too, one piece that I've been trying to message that I'm getting a lot of questions on is currently we are not sending out renewals for retail food licenses. So that's been a big question. And the state is being understanding of the fact of the big hit that the restaurant industry has taken with COVID-19. So at this time, we are not asking for renewal payments for 2021 retail food licenses. And so we're going to have some more information on this website once we get some detail from CDPHE as to when we are going to have some more specifics about 2021 licensing. But for right now, they are on hold and more to come on that. So stay tuned to this website. We'll always be updating it for you.
Awesome. Thank you, Sammy Jo. I appreciate all your help and everything that you've been working so hard towards. So any last things that you think are important or links that people should reference? I put the link that you the last couple links, if there's anything else you want me to include.
No, I think that's kind of where we're at for right now. I know you'll hear some more about the Bundle Up campaign and small acts. And so I know we put that on our website as well. But first and foremost, I just want to thank every single one of you. I mean, I can't imagine being a restaurant owner right now, what you're dealing with. And please know that from the bottom of my heart, I will do everything I can to keep you updated, give you those resources. I value your feedback. I value your input. And I will always continue to advocate for that. And I've talked to so many of you over the past few months, and a lot of you receive emails from me on all my memos and updates. And if you're not seeing those, just reach out to us so we can make sure you're getting that information. That is truly where my team and myself are spending all of our energy, is connecting with you guys and supporting you. So thank you.
Awesome. Thanks, Sammy Jo. Appreciate it. We're going to move on to another common question. So let's talk a little bit about sports facilities and gyms. So can we kind of speak a little bit to what that looks like? So, you know, is a sports facility considered a gym? How should we be acting in a gym? And what are some of the requirements in regards to that?
Sure, thank you, Mackenzie. I'll take this one since it is more in my lane here. So under the public health order currently, gyms are defined as a room or area that is used for any type of sport, exercise, dance studios, public swimming pools, bowling alleys are actually considered a gym as well. So that's where the category falls. One of the top questions we get is, say you own a volleyball club and you have a facility that's dedicated only to volleyball and you have courts within there. So as long as you are operating under the context of a gym, you can provide conditioning services, you can provide individual type of activities within that gym or within your facility. But what you cannot do is operate an organized recreational activity. So you couldn't have a game with multiple people involved, but you could offer conditioning services or individual training services within that facility as well. The other important thing to remember here is that no matter the size of the facility, you are currently under red restrictions reduced to 10% of your capacity and no more than 10 people in that facility at any time. That does exclude staff, but you can't have more than 10 participants engaging in any activity within that facility. That further also applies to pool areas. So if you operate a swimming club and you are utilizing a pool facility, you can only have 10 people per room. It's not per body of water, it is per room. No matter how large that room is, it's still 10 people per room within that facility. And additionally, another question that we see a lot come in is, do I have to wear a mask while I'm engaging in activity? And the answer to that would be yes. So even if you are inside a gym, let's say like Lifetime Fitness or 24 Hour Fitness or Gold's Gym, any of those facilities that still operate and are allowing you to make reservations to come in and work out, you still have to wear that mask while you are working out. Now, you can take the mask off to breathe really quickly after an intense activity, but the mask then has to go back on to continue working out the entire time while you're in that facility. The only other caveat to that is you do not have to wear a mask while you are in the pool or in the body of water and swimming. So maintaining distancing, making sure all the equipment is clean and not shared in between those activities, that's all the important things, and that seems to be our top comment or question or concern coming in right now with regards to level red.
Awesome, thanks, Kat. Super helpful. And all that information is on El Paso County Public website as well.
Absolutely. So all of our different categories are broken down and what you can and can't do within those restrictions in the same website you had up while Sammy Jo was talking about retail food.
Awesome, that's great. Appreciate that. And again, I'm getting some questions. We'll get to you guys here at the end. We're going to move on, and I'm hoping, Marla, you can kind of speak into variances and if there are any available currently, and do we anticipate any coming in the future, and kind of speak to some of those things.
Sure, thanks. Good morning, everyone. So currently in level red, El Paso County is not able to accept or approve or move forward any variances. Variances are approved by our state health department, so we locally cannot approve those. There's actually a flow process through which it goes through revision from the environmental health team, through our communicable disease team, through our leadership team, through Board of County Commissioners. All of that happens prior to being able to submit a variance for review by the state health department. So again, in level red, we're not able to even move any of those forward. If we were moved back to level orange, then we can consider outdoor only variances. The variance process has changed quite a bit since when we started writing these in back in June. And now most of the sectors are more formalized by their capacity and restrictions through the public health orders. So when someone is applying for a variance, it's usually for a very specific, like an increased capacity. Right now, the state is only accepting what are called site-specific variances, and those are only for facilities that are 30,000 square feet or larger. So very few of our very large facilities could be eligible to apply for a variance. All other facilities would fall under normal public health restrictions and capacities. So that said, then if we move back to orange, that would allow some facilitation of outdoor only specific, site-specific large facility variances. And if we moved back to blue, then we can entertain the indoor and outdoor site-specific variance requests. So that's kind of an overview of that process. So unfortunately, we really can't do anything to support larger capacity variances at this time while we're in the data and disease level that we have. But if we move back through those levels, then we can facilitate some of that review and approval through that process.
Thank you. That's super helpful, Marla. I appreciate that. And then we're going to move on to just questions about, in regards to event spaces. I'm hoping one of you can kind of speak into, what that looks like as an event, as, families gather for the holidays. In regards, what does that look like? We kind of went through that with Thanksgiving, but as we kind of come up into holiday season, how can we be cognizant of events and those types of things?
Sure, I'll start and I'll let anyone else join too. Just again to clarify, for level red, unfortunately, indoor events are closed. So that would then fall to what would be considered a personal gathering, which should be minimized at most, just to reduce any further community spread. But indoor actual seated events or standing are closed in level red. So we would have to delay, planning for those kinds of things until we move out of this level. But I'll let anyone else add to that as well.
Sure, certainly I can chime into that. So please keep in mind our role in public health is educating. And obviously we're not going to show up at your house and tell you that you can't gather with your family. But what we are asking is that you really think through those decisions, because what drives our ability, to Marla's point, to apply for variances and to better support our businesses is behavior change community-wide. So what we're really asking for is, as a community member, how can each of us do our part so that we do have the ability to go ahead and apply for variances and be able to open up higher capacities.
Awesome, that's helpful.
Marla, this is Lori Sego. I just wanted to jump in. I apologize for interrupting. I just want to correct one statement that you made, and that is that Outdoor variances are not available until we're in level yellow, and then level blue would allow us to apply for indoor and outdoor variances. So we are 2 levels away from being able to apply for outdoor variances.
Helpful. Great, I'll make a note of that too. So we're gonna, before I kind of go into the bundle up, I have a few questions here that I wanted to, we've got from people. Do we have any type of requirements on when the CFMs need to be in order to qualify as an outdoor space? So what does it mean to be an outdoor space?
Sure. So currently, again, the definition that CDPHE is asking us to use isn't necessarily using that metrics. They're truly looking at it from a perspective of ceilings and walls to define what that proper airflow is. So at this time, no, that is not a metric that we would use. So instead, again, the whole thought process behind having an outdoor space is that you have a full wall open. So really paying attention to the definition meaning a wall. And if you look at that document, it does kind of walk through that as well. So just having an open doorway wouldn't meet that definition. Having fans in a restaurant to try and push air through would not meet that definition. The definition that you would need to meet is an open wall opposite of each other, so non-adjacent walls. And again, any particular facility that feels they don't quite fit into these definitions, we will always partner with. I've accepted videos, photos, phone call after phone call from restaurants to work through these individually. So that is always something we're willing to do.
Great. Another question here. Are there different restrictions under the red category for critical businesses such as architects and engineers?
This is Lori, I'll take this one. So if you are indeed a critical business, which is defined in Appendix A of the Public Health Order, then you are allowed, what they call it is you're allowed to operate as normal. So there are no capacity restrictions on your office space or your meeting space or anything like that. You're allowed to operate as normal. There is a section in the Public Health Order in terms of your operational requirements that you must follow. And that has to do with employee screening, maximizing remote working as much as possible, wearing masks while indoors, things like that. But in terms of capacity requirements, critical businesses and critical government functions are allowed to operate as normal. And if you have a question about whether you qualify as a critical business, please feel free to call the number that Sammy Jo provided and contact public health staff, and we can get an answer for you.
Great. Anybody else want to speak to that at all before I move on? Okay. Next question. I have a retail store that has a conference room that people rent to hold meetings or school activities that holds 8 people. Are we still able to allow people to rent the room?
This is Lori Sego again. Unfortunately, you are not. Those activities would qualify as indoor events, and those are currently closed under level red.
Thank you. Our business doesn't fit neatly in any of the categories outlined in the restrictions. Who do we talk to see what restrictions apply to our business?
Absolutely. So that would be, again, contacting our COVID line, because that's exactly what we're here for, is to help you figure out where your particular business lies. So again, please contact our team at 719-578-3167. We'd be happy to help you figure that out.
Yep, and I put that in the chat as well. So in the follow-up, you'll have all that contact information. So thanks for the questions. You can keep them coming, everybody. Next question, how do you calculate the capacity for personal services business? Does that capacity number include employees?
Marla, do you want to take that one?
Sure, it's based on your building code or fire code occupancy for the space. And I believe we've gone back and forth. I'd have to pull up that section to reference what it says specifically about staff. I don't believe staff are included in that total, but I could be wrong for that section because there's some slight nuances in different sectors. So I would reference that appendix in the public health order to see what language is used there. But that would be 10 per room for that fire code occupancy or building code occupancy.
And this is Lori Sego. I'm trying to look it up real quick as we speak. As you read through the public health order, staff are always included in your capacity calculations unless it specifically says otherwise. So for whatever reason, there are some business sectors that specifically say your capacity is X, not including staff. And so that means you can exclude staff from that capacity calculation. If it does not say that, then you do include staff. And I'm looking up personal services in level red right now.
Sure, and while Lori does that, I will specify that for restaurants and retail food, it does explicitly state that staff are not included in those capacities. So I know for sure that particular sector does specify that out.
And I'm looking at personal services under red. It says that they may operate at 25% of the posted occupancy limit. Your occupancy limit is, again, your fire code occupancy. So hopefully you have that number posted somewhere in your building, or 25 people, whichever is less. There is not an exclusion for staff, so staff would be included in that calculation.
Awesome, that's super helpful. They can also call, in addition to what Sammy Jo had mentioned for the phone line, our statewide OEDIT SBDC COVID line for small businesses. So that hotline I'll put in the chat as well. And that's Monday through Friday, 8 through 5. So there's lots of good resources in order to get your questions answered really quickly. So next question goes into vaccinations. People have questions in regards to what the timeline looks like, kind of an update on that, if there is any.
That's you, Janelle. We can't hear you, Janelle.
Janelle. Here, I'll let you figure that. Just look for the little green guy. I'll let you play with that. I'll go to the next question here while you're figuring that out. In regards to schools, do you anticipate anything changing in regards to schools? Right now, I know where we're at is hybrid, can be in person. Schools are kind of making those decisions for themselves. I know my kids go to a charter school, so they're hybrid. Can you just talk to us a little bit about school and coming back from school, and if we anticipate, if anything changes over the holidays?
This is Lori Segal. I'll jump in. In the guidance provided by CDPHE, discretion is given to the school districts to do what they feel is most appropriate for their districts in every single level, including if we were to go to purple. It's in person, hybrid, or remote as appropriate. So the school districts are allowed to make the decisions in terms of what works best for them based on their particular circumstances. Obviously, we have very urban schools up in the Denver area that may have different circumstances than our more rural schools out on the Eastern Plains. So that's left up to the school district.
Great, that's helpful. Janelle, were you able to figure it out? Okay. Let's see if I can't help you on the back end here in a second, okay?
I'm having some technical difficulties with that, sorry.
That's okay. No problem. We'll work to that, but we do have a few questions about, moving forward in that regard. Just got one in that says, what about basketball teams in school? Will they be able to attend practice games and et cetera?
Sure, I can jump in on this one. Another question that we get frequently are, do the school-sponsored functions fall into the recreation guidance? And that answer to that is no. The personal recreation guidance that applies to gyms does not specifically apply to school or school-related functions. Those are governed under CHASA, who is working directly with the governor currently on how to proceed with their winter sports. So all that guidance related specifically to the schools, again, is at the school's discretion with guidance from the CHASA or the Colorado High School Sports Association.
That's super helpful. Few questions too, probably for you, Sammy Jo. Obviously, a lot of us have read the news about, the new 5-star exemption program that was pioneered by Mesa County. So can you talk to us a little bit about that and what we can expect, or anything that we're waiting on currently, or what that looks like for retail and restaurants, et cetera?
Absolutely. So what we have done is we developed, firstly, we took Mesa's program and then as a framework, and then put together one for us, and we started calling ours the Gold Medal Award Program. And we did present that to the state and asked if we would be allowed to be able to implement that certification award program is specific to restaurants, to say, hey, if restaurants met this criteria, would they be able to operate at a higher capacity than what's allowed right now? And so the short answer to that is, again, because of, to Marla's point, with our metrics being so high and us not being able to get any variances at this time, CDPHE has directed us that we do not have the ability to implement that program. I know there's a lot of misinformation out there and media circling, claiming that a lot of other counties are applying for it and are also implementing it. But right now, Mesa County is the only one that has that program. And because of that, what the state is actually doing now is digging a little deeper into what data they can look at for that pilot program. So they're going to look and see whether or not that program's working. Is it helping? Is it hurting? And where are those outbreaks truly lying? Are they more in restaurants? Are they across the board? So this is everything that the state is working on right now. So at this time, I don't have a crystal ball to say when exactly or if we'd be able to have that allowance. What I will tell you is that they are taking public comment on that. For now, they're doing a pilot of a statewide program. So because the state has been hit so hard by so many counties saying, hey, why can't we do that? They're now looking at developing a program that could just be applied equally across all the counties. And right now that's open for public comment. So I encourage you to go to CDPHE's website to go ahead and give that feedback. And if you don't know how to find that and you want to be able to, please reach out again to my team. We can make sure we get you in touch with that link. But that is where we're at this time. Again, everything is driven by our COVID-19 metrics, which are all on our website, and we'll be happy to answer any other questions on that.
Awesome, super helpful, Sammy Jo, especially touching on that it's at a statewide level that it's moving into. So, all right, let's go to that. Are you able to get on?
I did.
Awesome, thanks, Janelle. Yes, could you kind of speak to kind of where we're at in that regard? Would be immunizations.
Yeah, sure. So I tried to introduce myself earlier, but obviously I was having audio issues. So I am an emergency preparedness and response coordinator at El Paso County Public Health, and I'm leading the vaccine planning for the jurisdiction. So in regards to a timeline, we don't have specific dates, but we do have a planning timeline that we're working with right now. So Pfizer submitted for emergency use authorization on November 20th, and Moderna submitted on November 30th. So what we do know is that on December 10th, the FDA will be meeting to discuss the Pfizer emergency use authorization submission. We expect that they could make a decision within 24 to 72 hours. Once they make that decision to authorize the vaccine, Operation Warp Speed is going to begin to ship that vaccine within 24 hours of that decision. So we could potentially have vaccine on its way to Colorado by mid-December. Once it arrives in the state, we won't actually be able to administer it until we have final recommendations from the Advisory Committee on Immunization Practices, but we only anticipate that would be a few days after emergency use authorization is granted. It could be as early as 24 hours. So in terms of timeline, we anticipate that we will be vaccinating our first population group by the mid-end December.
Awesome, that's great, super helpful to know that. So I know there's a lot of kind of mixed comments and timelines and projections, so that's great that it's so soon. So love to hear that. We're going to move on because we have a few here. This is for you, Sammy, probably. Does Code Red affect curbside delivery or retail at all?
Great question. So you can absolutely still do takeout and delivery per usual, so that is not affected in any way in level red. And one thing that I will tack on with retail is right now retail is at a lower capacity, but they can still operate. So, and again, keyword being retail, it's kind of coined different ways. So if you're talking about retail food, like a grocery store, gas station, they are actually fall into a different category. So please keep that in mind. I do get a lot of questions about, well, why do the grocery stores get to be open? Why do, gas stations get to be open? So they actually fall under a different category outside of restaurants and bars. So again, they are considered critical in the fact that they are a critical base of our infrastructure in our community to keep things moving. So that's why even when restaurants aren't allowed to offer indoor dining, they can still offer their goods and services. But please know that they do fall under a different appendix, so they do still have rules that they have to fall under as far as implementing proper social distancing, and really still have to be in control of that. So it doesn't mean we can have floods and floods of people. So please know we do work with them as well on how to keep those facilities safe. And was the question leaning more towards retail goods, clothing, that sort of thing? Just want to make sure I'm fully answering it.
Yeah, just said retail, so I'd imagine it's that. So
I think this is, I'll just jump in real quick too on that front, just to cover all of the retail side. Our message right now, like Sammy previously said, we're really rooted in education and trying to help businesses be successful. So even on some of those Walmarts and Home Depots and Lowe's and Hobby Lobbies and any of those other retail goods stores, we really are encouraging them to utilize that curbside pickup or that online ordering and delivery services as well, just to try and keep as many people outside of that store from congregating within those areas as possible as well.
Super helpful. I'm just going to try to get as much as we can here question-wise. If El Paso County stays at 15% positivity, will we go into the purple zone on December 11th, 2 weeks after going into the red?
Sure. So Lori, please chime in if you have a better way to answer that question. But I know the big component of purple is the hospitals. So a big driver of a county going into level purple is because we have exceeded our capacities or at the brink of exceeding our hospital capacities. That's the driver for that. Lori, I'll let you add on if you have any further insight or anybody else on that.
I don't have any other specific information about that. I do know that, to my knowledge, the state has not notified us that we are headed toward purple. So as they have done in the past, usually we get at least a 2-week sort of, not a grace period, but a notification period that indicates that you're moving toward a particular level, and we're going to monitor for you for 2 weeks to see if you can bring your numbers down. To my knowledge, we have not received that communication from the state, but I certainly can't guarantee that we won't.
This is Michelle. I can jump in here too to kind of piggyback on what Sammy Jo had said. I think kind of the differentiating factor for level purple is that there really is an emphasis on the hospital metrics. So where some of the other levels, we're looking more at the 2-week incidence and the test positivity rate. That's not to say that those don't factor in for level purple, but some of the things they're looking at for level purple is whether we're having to utilize alternative care sites, or if we're reaching critical shortages of PPE or staff in our hospitals, or kind of approaching the need for some of the medical crisis standards of care, and just kind of breaching some of those levels of surge capacity. So it would be at a point where we're, our hospital systems are pretty taxed and at risk of being breached. And so it would be a pretty significant move. And we have not heard anything about that yet. I think, with El Paso County just moving into level red last week, the hope is that we'll really be able to hopefully move the needle on some of those numbers with the level red restrictions. And then kind of with the vaccine around the corner, I think that's a little bit encouraging as well. So hopefully we'll be able to get some, hopefully we'll see some progress with the level red restrictions.
And then what does timeline typically look like? Is it every couple weeks, or have they kind of said, we're going to see what this couple weeks looks like and then we'll reevaluate? Or how does that kind of work timeline wise in regards to what public gets information?
It has, similar to kind of what Lori said, it's been a period of kind of, typically it's been a couple weeks. Part of what they want to do in working with locals is really allowing a little bit of time to look at how those metrics are impacting the numbers. We do know that since COVID, since the virus has a longer incubation period, it takes a little bit of time to move the needles. And so it's kind of just finding that balance of reducing disease spread, but also recognizing that restrictions have, they do have economic impacts. And so I don't know that we have a clear timeline for level purple or what that would be, but I think there would be a lot of communication about, it's something that we would have to be looking at some pretty severe hospital capacity limits kind of statewide and at the county level as well. So we can definitely keep everyone informed as we learn more or hear differently. And in the meantime, public health, we are definitely here as a resource, and we just encourage folks to reach out as much as possible if you have questions or kind of just talk through some of what those next steps look like.
Looks like we have a couple more, and then we'll wrap up here. How are we relating to the rest of the state and then the rest of the country? So do we have kind of a pulse on, how El Paso County is doing in relation to Colorado, and then how Colorado is doing, for the rest of the country?
I can take a crack at that one. This is Fadi from the Office of Data Analytics. If you take a look at the state map in terms of the incidence, you can see that El Paso County is very similar in our situation right now, not only in being red, but also on the incidence level with Denver, with Adams, with Jefferson, sort of the typical counties that have similar population to ours, especially Denver. Now, the incidence is not going to be 100% match. We're not going to have identical incidence, but we're all fighting this elevated level in Colorado as a whole. And just to reiterate what Michelle has said, if there's a time when the state is going to place a county in a purple phase, it's very unlikely that a single county is going to be facing that alone, just because the incidence levels are so similar across the major counties in terms of population. In terms of Colorado's spike right now is also not unique. You probably heard in the news that the entire country is facing elevated levels of cases, which then lag and turn into elevated numbers of hospitals. And hopefully the further lagging in terms of deaths doesn't occur as much as it did in March and April, but you see that Colorado in itself is not unique in the spike that we're seeing right now. And it's not even a national uniqueness there. So across the world, we're seeing countries in Europe, in South America, and Africa that are starting to increase their case numbers.
And then two, there's kind of been, rumors of it. Is it a new kind of COVID? Is this the same kind of COVID? Has it mutated? I mean, there's lots of rumors about why suddenly the spike is again. So can anyone speak to sort of, or squash those rumors in regards to like what it means? Why are we all of a sudden seem so high again?
I can again take a quick crack at that, and everyone else feel free to chime in. This is of course speculation. There's no hard evidence to, and there probably never will be, to cause and effect that a single factor is influencing this spike. Different countries, different regions of the world, different parts of the hemisphere face different strains of the virus, but it's still SARS-CoV-2. It is still COVID-19. So as far as we know, there might be minor alteration in the virus DNA, but it's not like we're having a COVID-19 2.0. Every region faces different strains, and it's unique to that environment, but it's not a new virus. We're still dealing with COVID-19.
And this is Natalia, to add to what Fadi mentioned. We are seeing these increases in cases because we are seeing that there is a decrease in social distancing. There's more individuals going to work while ill and infectious. So we're just seeing a lot of those kinds of habits that are allowing for more spread of the disease.
That's super helpful. So we obviously have been, instructed, and we know to wear masks and to wash your hands and 6 feet social distancing. Is there anything else that you think is pertinent now, even more so, that we should be cognizant of or be taking care of, especially going into winter months?
Yeah, I would just add that to piggyback off of some of the campaigns, going around, the small act, big impact. Just one tiny thing, like knowing your neighbor maybe needs some assistance or is elderly or can't go out, helping out your neighbor, trying to think ahead of time that you're not going to 10 grocery stores in the same day. Just really trying to think through what your necessary stops are every day while still making those connections within the community. And I hear a lot of misinformation where people say, we shut restaurants down. Please understand that I know that unfortunately many restaurants have closed because of the financial burden that is upon them, but we still are, supporting and offering outdoor dining as well as takeout and delivery. There's still a lot of ways that you can support your local restaurants and small businesses. Retail shops for shopping are still open. They're just at a smaller capacity, and many have adapted their business model to try and fit these things. So please take advantage of all those small businesses that are trying to do their hardest to stay open. I think that's important because there's a safe way to do so.
That's super helpful, Sammy Jo, and that kind of leads me into, I just wanted to quick kind of discuss our Bundle Up campaign that the SBDC has worked hard with recovery team on here in El Paso County to provide this for businesses and consumers alike. So this can be found on pikespeaksbdc.org on their main website. This is a campaign that we've kind of married with the state, shop local, and then, like you said, the small acts, big impact here, at the city level. So we really just want everyone to understand, there is ways that we can, like we said, bundle up for small businesses and really take care of our businesses here in El Paso County. But a lot of cool facets to the Bundle Up campaign. The thing that we are most proud of is our cold weather toolkit here. So a lot of information that is similar to what El Paso County Public Health has, but it has lots of great information in regards to guidance and planning documents, legal assistance, marketing and promotional ideas, public health orders. Kind of gives a nice space that you can go and see, how can we learn about all these different items. And it's a living organism, so we update all this information as we all know, it comes new and fresh almost daily in a lot of ways. We also have awesome marketing collateral and logos. We're printing out signs and window decals to give to businesses to really encourage, especially on a day like today when it's 18 degrees, to really bundle up and take care of our small businesses and show up for them. Another really cool aspect to this is we've got an awesome video gallery, including you, Miss Sammy Jo, to include some public health tips here, HR tips, disease prevention refreshers. We just finished up a marketing series, how to pivot to more of an e-commerce as we move into kind of the colder months, as well as mental health, talking about how to talk to your employees about mental health and take care of them in the winter months in lieu of COVID. So, and then 2, we have these awesome bundle up stories that we're pairing some photographers that are here locally, startups, LGBTQ, minorities, vet owned, and marry them to, excuse me, some businesses here in El Paso County, Tri-Lakes, and Woodland Park. So we've got this awesome resource here. I'll be sure to include that with these slides that I'll pull up for you as well. So super excited about that, to talk about some of the campaigns that we can really take care of our small businesses. Does anybody have anything else that they'd like to add or wasn't mentioned before I wrap anything up?
Hi, it's Lisa. I would just like to encourage, if you have symptoms or feel that you've been exposed to COVID, to please go get testing. We have low barrier, no cost testing available throughout the city. And we really encourage people to go and get testing.
Mackenzie, if I can add one more quick thing too. The SBDC website, pikespeaksbdc.org/prepare is the second main website in support of small businesses in the pandemic. That page has a lot of good information on grants that are currently available, such as the artist grants that are out right now. Colorado Restaurant Association's grant is open until November 12th for outdoor spaces and needs, and also a lot of information on loan programs, other funding sources, and the specifics for all of that too, because we know there's a lot of information you need. So just want to point out, pikespeaksbdc.org/prepare is that second pandemic support website that we have.
Awesome. Thanks, Ekta. I also wanted to include too that we do have a webinar tomorrow. So we're getting updates from City of Colorado Springs in regards to outdoor structures and winter outdoor seating. So I will send this information. If you want to go online right now and sign up, you go to pikespeaksbdc.org, go to workshops. We've got city clerks, liquor enforcement officers, deputy fire marshals, planning managers to kind of give you an idea of, Sammy will be there obviously too. In regards to how are we going to set our restaurants up for success in regards to winter in the future. So, and again, thank you so much for being a part of this. Thank you to each of you at El Paso County Public Health for taking the time. We got through all the questions. If you have additional questions, we do have information that I will be sending out as a follow-up to everyone in regards to how to get a hold of them, as they all each have their specialties. So thank you so much for being here today and taking the time. And I know it's a lot of work that you all put in the last, I guess it's been 8-9 months. And so we really appreciate your diligence and the way that you really work with all of our businesses here. We're so grateful for you. And the Pikes Peak Small Business Development Center, obviously, like Ekta was saying, we do provide free consulting and practical training and business resources here for El Paso County and the Pikes Peak region. So if you need to get a hold of us, of course, go to pikespeaksbdc.org. Please utilize our free consulting. We have amazing consultants with incredible results, and we appreciate you being a part of this here today. And thank you. So anybody else want to say anything before we head out?
Just wanted to say thank you again, and for any restaurant owner out there, please join us tomorrow. Like Mackenzie said, we'll get to some more nitty-gritty questions about dining outdoors. Thank you.
Yes. Thanks everybody for being here today. I'll be sure to send this on to everyone. Thanks so much. Take care. Bye.
Thank you.
Thank you.